Early detection is the key in the fight against cancer treatment, and Cancer Treatment Centers of America now has a powerful tool to diagnose and stage tumors with improved accuracy. It's also the first of its kind in North America. Radiologist Dr. Timothy McCay is here. Timothy, thank you for being here. We really appreciate it. So this is a huge breakthrough. Tell me what's happened.
PET-CT is a machine that we utilize to stage cancer. It's for early detection. It's to help stage the patient to determine what stage of cancer they have. And then as they go through therapy, it helps to determine if the therapy is working and if the cancer is returned.
So what is different about this new technology?
This technology that was just brought out by GE has several factors, which is a brand new platform for PET-CT. One is it has a resolution of 0.28 centimeters or 2.8 millimeters, which is very small. All the other PET-CTs before had a resolution of about 10 millimeters. So we can really see lesions smaller than before.
So take me through the process. It used to be that someone would come in, you might see something, you weren't sure what it was because you didn't have the resolution, and you'd tell them, you got to wait and see.
Come back in 3 months. We'd see a small pulmonary nodule, for instance, or something maybe small in the liver, and we'd say, we don't know for sure what it is. It may be a cancer, it may not be cancer. We'll do another scan in 3 months, and at that point we'll determine whether or not we need to reinstitute therapy or change your therapy. And now with the new PET-CT scanner, we're able to detect those lesions, determine whether or not they're PET-avid, which will tell us whether or not it's a malignancy, and then start therapy immediately.
Well, I know with the entire battle against cancer, early detection is the key. So it helps your treatment to know earlier, but also to have to sit and wait 3 months not knowing the results, not having to wait to do another scan, the ability to cut that out, that uncertainty out, give them the answers they need and begin treatment right away. It's got to be huge for the patients.
It's huge for the patients. It's huge for the whole fight against cancer. Cancer Treatment Centers of America is committed to the patient. Everything that they focus on is about the patient. When it came down to whether or not we were going to buy this machine, most hospitals look and determine whether or not it will pay for itself, what new things you can do with it in order to pay for it. The chairman of the board and the board simply wanted to know, what is this going to do to help fight against cancer? And when I presented the technology of 2.8 millimeter resolution, motion management, you know, for the lesion that's moving next to the liver, we can now freeze that in time, and things like that. They said, buy it, just get it.
I've understood some things. When there's a part of the body that is in constant motion, it's really hard to get a clear picture of what's going on there.
Well, resolution is based on being able to get a picture of it in time. Mm-hmm. Well, when you're laying on the table getting this PET-CT, you're breathing, your heart's beating, things are moving that you can't stop. So GE has a technology to map out the respiratory cycle. So when you're looking at an area, it's moving in the lung, they can actually watch it as it goes up and down with the respiratory cycle. Then we can transfer that over to radiation therapy, and we can treat it with radiation therapy during the same respiratory cycle.
So that information is also used in treatment as well as diagnosis.
Exactly.
Wow. Okay. Well, you mentioned GE. Mm-hmm. I know that you worked with them to bring this. This is the first one in North America.
That is correct.
And it's at the Cancer Treatment Centers of America, which are in Tulsa, by the way. The closest one is in Tulsa. It's just right up the road. And this is huge for the entire, center portion of the country is going to be utilizing this. How did GE get involved quickly? We've got about 30 seconds left.
It was just a quick marriage. We trusted GE that the technology was going to work. They knew that we could provide the patient population that could really highlight the strengths of this machine. And again, once we saw what it was going to do for the patient, the board simply said, spend the money, get it in here, and let's get it going.
Well, we appreciate you being here. If you would like more information, you can call Cancer Treatment Centers of America at 800-333-CTCA or at cancercenter.com for more information. Thank you so much for being here.